Welcome to 2-Minute MRCP. Today we'll review Barrett's esophagus. Barrett's esophagus refers to metaplasia of the lower esophageal mucosa, where the normal squamous epithelium is replaced by columnar epithelium. Why is this important? Because Barrett's esophagus significantly increases the risk of esophageal adenocarcinoma, with a risk estimated to be 50 to 100 times higher than the general population. There is no routine screening program for Barrett's esophagus. It is usually discovered during endoscopy performed for upper gastrointestinal symptoms such as dyspepsia or reflux. Barrett's esophagus can be classified according to length. Short segment Barrett's is less than 3 cm. Long segment Barrett's is more than 3 cm. The longer the affected segment, the greater the likelihood of finding intestinal metaplasia. Histologically, the abnormal columnar epithelium may resemble either gastric cardiac mucosa or intestinal mucosa containing goblet cells and a brush border. Let's look at the risk factors. The strongest risk factor is gastroesophageal reflux disease, or GERD. Other important risk factors include male gender, with a male-to-female ratio of about 7:1, smoking, and central obesity. Interestingly, alcohol is not considered an independent risk factor for Barrett's esophagus, although it is associated with both GERD and esophageal cancer. Barrett's itself is usually asymptomatic, but many patients have symptoms of coexisting GERD, such as heartburn and acid reflux. Now, let's discuss management. Patients are commonly treated with high-dose proton pump inhibitors. However, evidence that PPI prevent progression to dysplasia or reverse Barrett's changes is limited. Endoscopic surveillance with biopsies is recommended. For patients with metaplasia without dysplasia, endoscopy is usually repeated every 3 to 5 years. If any grade of dysplasia is detected, endoscopic treatment is indicated. Radiofrequency ablation is the preferred first-line treatment, especially for low-grade dysplasia. Another option is endoscopic mucosal resection. And that's all about Barrett's esophagus. If you found this helpful, don't forget to like, share, and subscribe to 2-Minute MRCP for more quick revision videos.